Hello and welcome to the Patient Educators Update. My name is Chuck Jones. I'm with Synergy Broadcast, and I'm pleased to welcome Fran London to our show today. Hi, Fran.
Hi, Chuck.
For those of you who may or may not know, Fran is the Patient Education Specialist at Phoenix Children's Medical Center in Phoenix, Arizona, and she's also the author of the book, No Time to Teach. This is a great book for patient educators. Provides them with some really practical tips, and as a sub-heading of this is the essence of patient and family education for healthcare providers. And it's the book that we take the majority of our topics from for our show. And today, Fran, we're going to focus on the chapter in your book that talks about self-efficacy. It's on page 165. And this is kind of something that patients face more and more today, and that's where the patient is faced with a new diagnosis. And this new diagnosis brings new challenges, whether it be diabetes or cancer or you name it. And this is going to require them to have some new self-care behaviors. There's got to be behavior change in order for them to manage their diagnosis, their disease, whatever has happened. And I would guess that for many people this can be overwhelming, it can be emotional, and it can be problematic in terms of their either willingness to change or whether or not they even believe they can do it. So talk to us a little bit about self-efficacy, what it is, and kind of what's going on here.
Well, you said it. The core of self-efficacy is that you can't make the change unless you believe it's possible. One thing that I see at Phoenix Children's all the time is a family who has a newborn who was premature and who's in an incubator. And they just see the size of the baby and all the things they have to do to take care of it. And they're terrified they're going to break the child, or they don't know how to take. And if they don't believe they can do it, they're not going to be able to do it. And that's basically what self-efficacy means. Do you believe it's possible?
Now, let me take a step back and say, you can talk to the patient about that, and they can say, yeah, I can do it, but don't you really need to dig down into that to really find out if they can do it, if they believe they can do it?
Absolutely. And there are questions to ask that can try to get at that. For example, someone who's a newly diagnosed diabetic who has to give him or herself injections that they never had to do before. And their first impression is, no, I will not do that. That's their first reaction.
Yeah.
And then they think about it and, yeah, I'd rather stay alive for another couple of years. Okay, I guess I have to. And then you can ask them something like, well, on a scale of 0 to 10, how hard do you think it will be to actually do this? Do you believe you can do this? And if they come up with a 3, they really can't believe they can do it. They should come up with a 7 or higher in terms of belief that it's possible. And the things we will talk about in future episodes will be how to get them to be higher. But the first thing you have to establish is it possible? Because it's not worth doing a whole lot of detailed teaching if they don't think it's even within their realm of possibility.
That totally makes sense. So self-efficacy is all about their perceptions and their confidence to be able to make these behavior changes and do what they have to do to keep themselves alive. And it's incumbent upon the educator to drill down and make sure that they understand what the patient understands and then do what they can to help them build their confidence and their ability to do it over time. Now, in your book, you talk about there are 4 ways to increase self-efficacy, and those are skills mastery, modeling, reinterpretation of physiological signs, and social persuasion. Now, rather than cover those in this episode, what we're going to do is break this up into 4 individual episodes so that we can talk about each one individually. And these episodes will follow this one on what is self-efficacy. So we'll wind up with some shorter episodes, which I think the viewers will like, and then we'll also wind up with 5 episodes on the process and what to do. That make sense?
That's perfect. Yes.
Okay, cool. All right. Well, then that's all we're going to cover today. So why don't you tell folks how they can find you online?
Oh, I've got a website, a blog on patient education at www.notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay, cool. And for those of you who are interested, Fran's book, which I'm going to show right here, No Time to Teach, is available in both print form and electronic form. So you can get it for your Kindle or other e-readers. And for those of you that are hospitals or teachers and you would like to use Fran's book in your education process, you can get a bulk discount from her publisher, Pritchett and Hull, and their website address is simple and easy. It's p-h.com, and you can get a sizable discount on bulk purchases of this for your students. And for the viewers out there that are interested in adding video and video on demand into their patient education process, we make a system called MMDS, which is our video on demand patient education system, and you can find out more information by visiting our website, synergybroadcast.com, and you can also find us on Facebook, and we're on Twitter. We're also on Google Plus and Pinterest and YouTube as well, which is where all these episodes are posted as well. So we want to thank everybody for watching this week, and Fran, I'll talk to you next time.
Okay. Bye, Chuck.
Bye-bye.